Hey everyone, I'm Dr. Andrew Hubbard, naturopathic doctor. What happens when diet doesn't work for your digestive symptoms? This is something I see commonly. I see people come into my office and they say, you know what, I've tried diet and it doesn't work, and I'm not sure what to do next. And so there can be many reasons why diet doesn't work, and there can also be a lot of times when diet is all somebody needs. And so, what I mean by that is when somebody tries, let's say, for example, a low FODMAPs diet, which is now a evidence-based therapy for treating the symptoms of irritable bowel syndrome, such as abdominal pain, diarrhea. And so that's a well-trialed diet that we know works in a lot of people, but doesn't work for everybody. And so, why doesn't work for everybody? Well, the first reason is that we can develop a condition called small intestinal bacterial overgrowth. And we call this SIBO for short. And SIBO basically is when you have too much bacteria growing in your small intestine. Now, there can be various reasons for this, but some of the more common reasons are somebody who's had a previous abdominal surgery. So this could be a C-section, it could be having your appendix removed when you were 19, and it could be having a hysterectomy, right? So what happens when you have a surgery is that oftentimes you get the development of scar tissue. And this scar tissue leads to impairment of how the small intestine moves food along the digestive tract. So SIBO tends to impact something called motility, which is that movement, and it also tends to impact the fermentation of foods in your gut. Because normally, we should be fermenting our food in our colon. Okay? We shouldn't be over fermenting our food in our small intestine. There should be actually few bacteria in the small intestine. So SIBO is the first reason why diet may not work. And to say that, let me preface that with diet can certainly help in the treatment of SIBO, but on its own, it rarely is going to resolve the issue. So that's the first reason. The second reason is something called visceral hypersensitivity. And visceral hypersensitivity, as the name implies, is hypersensitivity of the viscera. In this case, we're talking about the nerves in the digestive tract. And so let's say you've had a traumatic life event, or you've had a really bad case of food poisoning. These are two risk factors for developing visceral hypersensitivity. And it's pretty much common throughout all functional gastrointestinal disorders, so things like IBS. And so if this happens, we need to address this. And this is something that, again, diet may help in reducing the amount of things that are fermented in the digestive tract and the amount of gas we produce. Because in visceral hypersensitivity, somebody may sense a normal amount of gas and they may perceive that as pain. So that's part of visceral hypersensitivity. So these two common reasons, SIBO and visceral hypersensitivity, they need to be addressed. And oftentimes, diet will fail on its own to do that. And so we have some really great naturopathic treatments that you can utilize, and that can be very helpful on your healing journey.